Medical experts are asking for global best practices in the oil and gas industry and stricter regulations by the federal government to effect compliance by the international oil companies. At a public lecture in Yenagoa, they discussed the health implications of oil exploration and gas flaring. Obiatime George has details.
A report in 2018 from the Department of Petroleum Resources reveals that despite a 70% reduction in gas flaring, Nigeria ranks 7th among countries still flaring gas in the world.
Only one can be first.
It is of great concern to members of the Association of General and Private Medical Practitioners of Nigeria when they met in Yenagoa. One major focus of deliberations here is the health implications of oil exploration and gas flaring in Bayelsa in particular and Nigeria in general.
Men, women, children end up with various degrees of chest infection, some of which end up with cancer of the lungs. Everywhere you find oil spillage, no grass grows. That also shows that no food crop can grow. You now find a largely farming population going hungry.
All of us here in the Niger Delta, we are essentially walking about as polluted individuals. Polluted by gas, polluted by crude spillages and so on and so forth. That our life expectancy has reduced by well over 10 years.
Fellow of the association.
The health implications may be grave, but guest speakers at the lecture believe solutions are still within a touching distance.
The oil companies should use the same type of technology, the same standards that they use when they do exploration in developed countries, so that they could minimize spillage and destruction of the ecosystem. And the government should also enforce the laws, the existing laws about gas flaring and even oil exploration on the oil companies.
The IOCs must clean up the Niger Delta. They must pay up. There's an international maxim, there's an international order, international law that says polluters must pay. Unfortunately, it's only in the Niger Delta that polluters do not pay. They pollute and go away with it.
The association wrapped up its annual general meeting with a free medical outreach.
We are having this medical outreach for persons that may not be able to treat themselves in hospital, and we are doing it free of charge. Free consultation, free drugs.
Obiatime George, TVC News, Yenagoa, Bayelsa State.